All right, so we're gonna go ahead and get started. My name is Amanda. The reason why we had started this Facebook Live podcast is because one of our friends, Ryan, he had a couple different goals that he wanted to do before he passed away. And I told him that I would, honor some of his goals if he passed away first, or or vice versa. And another reason we wanted to do that is because we wanted to spread some more CHD awareness to some other heart families and other patients. And I want to make sure and let you guys know that we are not medical professionals. All of our experiences, or all of what we say, is our own experiences. Everyone is different. No one is the same. There is 5 of us, but Megan is going to be a little bit late. She is out celebrating her birthday. And we're going to go ahead and I'm going to have Texas go ahead and introduce himself first.
I am Texas. I am 38, will be 39 at the end of next month. I was born with TGA, tricuspid atresia, dextrocardia, ASD, VSD, pulmonary stenosis, and I think that is it. Currently live in Texas. I am seen down in Houston at Texas Children's, and I have various doctors from heart to liver to a blood doctor. So that's me.
Laura.
Hi, my name is Laura. I am 36 years old, and I had to think about that one a little bit extra hard today. I was born with classic tricuspid atresia, so including the ASD, VSD, as well as pulmonary stenosis. I am a teacher, and I currently live in Minneapolis, but I grew up in Washington State, so I share my adult congenital care between University of Washington in Seattle, as well as University of Minnesota in the Twin Cities.
AJ.
Hello, I'm AJ. I'm 34. I just turned 34 in January the 9th. So I had to think about that too, Laura. I have hypoplastic right heart, pulmonary atresia. I'm originally from Kansas, but I live in Phoenix, Arizona now. I see a doctor, pediatric doctor at Phoenix Children's Hospital. And I'm a university counselor at Grand Canyon University. So that's me.
And again, my name is Amanda. I was born with hypoplastic right heart, tricuspid atresia, ASD, VSD, obviously single ventricle. I am 40 years old now. I just turned 40 in December. I almost had to think about that, but I didn't, because yeah, that's kind of crazy being 40, but anyways, and I live in Ohio. Tonight's topics are growing up and general questions on surgeries. So I want to ask all of you guys, what was your first surgery like? As in like a shunt, or did you have the Fontan? We'll go ahead and go with Laura first.
My first surgery was the Blaylock-Tossig Thomas shunt, and I had that surgery at 36 hours old, roughly. When I was born, I presented normal. I even scored 9 out of 10 on the APGAR test. But then at 24 hours, I turned blue and was airlifted out of my home in Northwest Washington down to Seattle Children's, where upon arrival, they took me into the OR and did the Blaylock-Tossig Thomas shunt, which, if you're not familiar with that surgery, it connects a subclavian artery to your pulmonary artery to get some extra blood flow to the lungs.
Okay. AJ?
Sorry, computer technique. So let's see. When I was born in a small town in Kansas, and they knew nothing about any heart conditions, which most people didn't in 1988 if you weren't in a big city. So I was born blue as it can be, my mom always said. So they rushed me all the way to the big city in Kansas called Wichita. And I had a shunt and some scar tissue removal when I was like 2 days old, 3 days old. Also, fun fact: when I was in the NICU there, I was born 9 pounds 9 ounces. I outweighed every baby on the NICU floor combined because I was so big. Which later they told me, good thing I was so big, or I probably wouldn't have survived. But after that, when I was 3 years old, I had a modified Fontan. I only have one memory of that surgery. I was only 3 in 1991. I remember waking up, I think it was either after my surgery, and I look over and there was an older lady beside me in the post-op or pre-op that had one of those oxygen needle things on her toe. And that's the only thing I remember. Also, I'll tell you a little fun fact. So my 2 grandmas got a nurse kicked off the ward because they were being mean to me. So never mess with the grandmas when during surgery. I'll tell you that, or moms either. And then when I turned 14, I started having some trouble. So this has been 2002. So in 2003, I had a stent placed in where they did my Fontan. And then in 2000, man, I'm really trying to think when these surgeries were. In 2020, not 2020, sorry, 2008, I had, they maximized my stent by like 4 milliliters, millimeters, not milliliters, sorry, millimeters. So it made me feel better, but kind of. But after that, they told me the next year I was starting having problems again. In 2009 when I was 21, and they said either you live with this for a couple more years until it gets dire and you need surgery, or you have surgery now. So then I had a Fontana revision done in 2009. I remember everything. I was 21, so I remember waking up with lots of medicines, a Hepralock right there on my neck. I remember watching the LA Lakers win the championship on TV. I remember a lot of things, so a lot more than I was 3 years old. But ever since then, I really haven't had any more surgeries since then.
Texas.
So yeah, so I was born just right outside of Houston, and once I was born, they kind of realized there was something not right with me. I've been told I was airlifted, and then I've been corrected and say I was just taken by an ambulance to Herman Memorial. Either way, I was transferred to Herman Memorial, and I had the BTT shunt within 24, 36 hours. I've been told different things. I'm not really sure who was correct in my family and who's not. And then I had the BTT shunt until I was 8 years old when they did my Fontan, which I had that in Austin at the now closed Breckenridge. I think it actually changed holders. I had it down there. I remember a lot from my Fontan. I remember, the night before going to the hospital and then being woken up early in the morning, having to drink this nasty drink and throwing it up when the nurse, as she was, as I think my mom was holding me and the nurse was crouching down in front of me and I just all over her. Now I remember them thinking, they may not be able to do the surgery because I threw it up, but they went ahead with it. Remember being carried down and having a little prayer circle with my family. And then remember waking up in the ICU with all the different chest tubes and all sorts of machines hooked up to me. One thing my dad said to me, he told me recently, we were talking about my heart surgery, was they were wheeling me out of surgery to the ICU, and I guess my hand or my foot was sticking out and I was no longer blue. And my dad was like, okay, well, I know he's gonna be okay now. So then I do remember them pulling the chest tube out early in the morning. That was fun. I had both my uncles were down there with me, helping out. My one uncle, he was stationed in Austin at the Air Force Base at the time. And then my other uncle came in from Houston, and they came up to see me, and they took me out of bed and had me walking around the ICU floor. And my mom was not happy and the doctor wasn't happy, but it was probably a good thing to get me out of the bed, get me moving. Then I was out of the hospital after 9 days. Originally wanted me out. They were going to release me after 7, but I had some extra fluid. So they kept me around for another few days, and so that got off. And then ever since I was 8, I haven't had any other heart procedures.
Okay. I was born in 1981, and I don't remember my BTT shunt. It's very, very blurry on that part. But I do remember my Fontan, and that was in 85, and I was 4 years old on that. It was pretty traumatic for me. And it's still, I kind of have some different flashbacks from it from now. Really won't go into detail on what actually happened, but and then I had a pacemaker in 2017, and then put on oxygen also on 2017, 24/7, and I've never had a revision, and I had the classic Fontan. So Laura, did you say that you did have a revision?
No, I thought your first question, Amanda, was just to talk about our first surgery. So again, the first surgery was the BTT shunt, and that lasted 6 years. So had that in 85 when I was born. And then in 1991, leading up to my Fontan, I just remember like being in the bathtub and literally face planting in the water and being like jerked back up again. Probably happened a little more often than I should have let on, but finally I told my mom because I was scared. So that led down the road to, oh, maybe Laura needs another heart procedure. So went back down to Seattle Children's. I had in 1991 what they called the hemifontan. It's kind of like the pre-Glenn shunt. And after that procedure, my heart filled with blood clots and I didn't do very well. The original plan was to do the hemifontan, wait 6 months to a year, and then complete the Fontan circulation. But because I was doing so poorly after the hemifontan, the cardiac team asked my parents if they could do the Fontan. They said, the good news is we have the technology and the skills to do the Fontan. The bad news is she won't survive. Can we do it for research? My mom says that she remembers asking, just putting up her hands going 10, as in, is there a 10% chance Laura will survive? And the response was, we can't guarantee 5. So another family in the cardiac ICU gave up their daughter's surgical slot, and 6 days after my hemifontan, they completed my Fontan. It turned out much better than their research predicted, but I was on a ventilator for 2 weeks after the Fontan. I was in a drug-induced coma for several days because they couldn't sew my chest back shut. So I was in the hospital for a month after the Fontan, but they told my parents to take off the entire year. So when I skipped out a month after the Fontan, they were all really happily surprised.
And so I hear, and I know we've all heard this before too, in different chats and different people we talk to. Do you guys have like a certain smell that you kind of remember and kind of associate it with the hospital, going when we were younger, having surgeries or anything like that. Let's see, Texas.
Not that I can think of. The only thing I can think of maybe is the gel they use for the echoes. I'm trying to think. I don't think I could drink apple juice for a couple of years after my Fontan just because of that nasty whatever. I'm not even sure what it was for. But I can't really think of anything. I don't know, maybe I just blocked it out or something.
Yeah. What about you, AJ?
Mine has always been rubbing alcohol. If I smell any kind of rubbing alcohol, hand sanitizer, even when I turned 21, even if I smelled vodka, it would take me right back to the hospital, which I did not like being in. But especially since after my second open heart when I was 2009, I mean, I remembered everything. I remembered that smell really kicked up.
What about you, Laura?
I mean, I have to agree with AJ, just that rubbing alcohol and that really sterile environment smell. I remember when I was 9, I went with a family, like a friend and their family, to pick up their youngest sister from daycare, and daycare smelled like that. And I was like, I'm going to wait by the car. This also might sound gross, but the smell of boogers. And I say the smell of boogers is really vivid because after my Fontan, I had a feeding tube. And one morning, my dad came to see me and I had to go to the bathroom. So he was helping me get out of bed. But my dad just like pulled back all my blankets, and wrapped up in that blanket was my feeding tube. So not only, anyway, the amount of boogers that was on that thing was also quite majestical at the age of 6. So that definitely is a sensory and a smell memory as well. And just, I mean, again, gross, but like when they took off they called it like the club for the IV, but it just smells like, so like nasty body smells and yet sterilely clean. And grape popsicles, which are the worst. And I was very sad whenever the nurse would bring me grape, but I was too nice to say no.
I would have to say, for me, I'm like AJ. Rubbing alcohol doesn't get me every time, but most of the time it does. And then different types of hand sanitizer. And then I'm not sure how this kind of plays in role, but when people are picking at their fingernails or picking at their fingers, I get that. I don't know. It just makes me think of hospital type stuff. And I don't know. It just, to me, how people are like, their hands go down a chalkboard. That's kind of like, for me, that's that. We did have one question. Actually, we had a couple questions come in here. Laura, can you explain to us what the Fontan is?
Yes, so my understanding of the Fontan circulation is that they take your superior vena cava, which brings blood from the top part of your body down, and the inferior vena cava, so bringing blood from the bottom. In a 4-chambered heart, they would normally dump out into the right atria. Through the right atria, a tricuspid valve would open, they'd go into the right ventricle, pump to the lungs. But with all of us having a single ventricle anatomy, there's really no place for those vena cavas to dump out to. So with the Fontan, and my version especially, because it's called the lateral tunnel, they tunnel the vena cavas together. So it becomes like one giant vena cava instead of the 2 separated ones. And then that connection of the vena cavas is directly connected to the pulmonary artery. And through a passive pressure system, blood is then brought to the lungs from the pulmonary artery, which is one reason why hydration is usually very important in patients with single ventricle with the Fontan physiology, because it's just that pressure system that brings our blood to the lungs. There's a couple variations of the Fontan, depending on how much of your like right heart-sided structure they use. If there's a hole in the Fontan, like tunnel, it's called a fenestration. I think they're up to 3 different versions of the Fontan, depending on the connections of the superior and inferior vena cava.
Okay, thank you. I knew you could explain that a lot better than the rest of us 3. Okay, so this next question is for all of us. Do any of you have any planned procedures in the near future? Who wants to go first? Go ahead, AJ. You're thinking about that.
Well, I don't have a planned open heart per se. I do have a planned, whenever I get around to it, I guess, a heart cath that's going to turn into a liver biopsy for a totally liver biopsy because we've had a Fontan procedure. That's about it I have. And then, all of us have echocardiograms, all that stuff eventually. But the heart cath and liver biopsy about the only two things I think is that I have planned.
What about you, Texas?
I was supposed to have an endoscopy next Monday, but I had to push that back because I don't have anybody to pick me up and they won't let me drive home after the anesthesia. And that's kind of connected to the fall. They're checking for the varices in my throat to make sure none are about to rupture or anything like that. Then I have an MRI scheduled for my liver in April when I go down to Houston. Just 6-month liver checkup, and then I do have a genetic blood disorder, and I go every 2 to 4 months to get a phlebotomy to get the iron out of my body. But other than that, just regular echo and EKG and all that good stuff.
Laura?
I'm gonna schedule a cardiac MRI here for the next 6 months, like within the next 6 months. Main purpose of that is to kind of look not only at the Fontan, but collateral veins. So where my body has grown extra veins where they're not necessarily supposed to be. I've had a couple cardiac cath procedures in the last decade to coil off those collateral veins. So the MRI will just help us to see where more collaterals may be going or what they're trying to do. But other than that, I get a liver CT scan once a year, and then echo at least once a year, if not twice a year, when I see the cardiologist.
I know I'm still kind of waiting on a couple different test results to come back. I do have, it's called FALD. It's Fontan associated liver disease, and it's cirrhosis. Basically, a lot of or majority of us single ventricle patients get a type of Fontan liver disease, either being fibrosis or cirrhosis. Eventually, I'm gonna have to have a heart transplant. Not 100% sure when. Possibly, maybe even a liver. That's like not out of the question, but right now my liver is not that bad, they're saying, but definitely heart. And then just my regular ultrasound, liver scans, blood work a lot. I go about every 6 months for both appointments, and then if I have to go more, then they just call me in and I come in and do it. So
could I interject something, Amanda?
Go ahead.
Oh, I was just going to say to kind of share a little bit more of what Amanda and Texas touched on this too with the Fontan associated liver disease. So what's really cool about the Fontan is we're surviving and living longer with this circulation. What they didn't know like 40 years ago when they created it was that it would have a negative impact literally on the liver. And it's because of that vena cava pressure and any excess pressures in the vena cava from the Fontan circulation. I say that it just like smacks the liver, and it's really almost impossible not to have some sort of an impact on the liver in that negative sense. But everyone's degree of it is different. I started in fibrosis. I now do have Fontan circulation, cirrhosis, not related to alcohol use. And they just watch it, and the liver function, though, is perfectly fine. Just kind of gets beat up.
Thank you, Laura. Okay, so we do have another question here. It says, to this day, do your parents suffer from PTSD because of your CHD journey?
My mom, yes. Yes, my mom does. Pretty much anytime I go to the doctor, she blames herself and keeps on reliving it. I always tell her it's her fault, and I try and joke around with her and whatnot, but I know deep down it still bothers her to this day. My dad, I don't think it does as much, if at all, but definitely my mom.
I think mine do a little bit. I'm not sure. I know when I was growing up, if anything was wrong, my mom would always be the most worried. And I always joked around with them once I got older. Hey, I'm doing fine. I'm 25 years old. I know how to take care of myself, but parents will be parents, as we all know. I'm a parent now, and I get what my parents said, what my parents thinking now. My son is heart healthy, but I still worry about everything about him. Even now, I live 16 hours away from them. I think it might be worse now, because if my wife and I call and say, hey, I'm going to the hospital, they're like, do we need to come down? Do we need to come see you? I was like, no, we're fine. If something really goes wrong, we'll call you. If I get admitted or something's wrong with my heart, then you guys can come down. But not just because I'm going in for chest pain, which probably 10 times out of 10, I just need to switch my medication, or I overdid myself like I did last year. So I think a little bit, yes.
Laura?
I don't know if I'd call it PTSD. I think I have a little PTSD. My mom definitely has a aggressive mama bear mode, and even at 70, she can still go into that mode. When I was little, she was once written up in my charts. And kind of like AJ was saying, don't be mean to a grandma. When I was having my Fontan in the ICU, the sheets were blue. And my mother yelled at the nurses, why would you put a cyanotic kid on blue sheets? And when she came back after lunch, I was on pink sheets. So there is definitely that like protective mode. And I think somewhere in the back of, her head, she blames herself, which again, I tell her not to. Like, you'll never believe this, but a geneticist said I was normal. So it's nothing that my parents did that caused this. But I'm blessed to have great parents who are probably still overly concerned about their 36-year-old child.
I know my mom doesn't really talk about it much, but I think deep down inside, I think she does suffer a little bit from it. And it's, I keep telling her the same thing as what you guys do. It's not her fault. A lot of times she says, I just wish I could trade you bodies. CHD is the only way I know how to live. We all adapted to it. We're doing great. We're thriving. I think I do suffer from medical PTSD. A lot of it is, I get so much anxiety going to doctor's offices, dentists, trying to think of, okay, did I take my medication for this or for that? And, are they gonna nick my gums? Am I gonna be bleeding? Am I gonna get an infection? Just little stuff really kind of gets to me sometimes. So we do have another question here. Did any of you get the Glenn procedure? Laura?
technically mine was the Hemi-Fontan, and I don't know enough about the nuances to know the difference. I think part of it was where your surgeon was trained regionally, and the other part honestly might be the timeline. And I was in 91 and it just seemed to be the Hemi-Fontan. But it wasn't the Glen.
I honestly don't remember. I went to my cardiologist in last September and I asked him if I had either the Glen or the BTT. And I really don't remember which one I asked him because whatever I asked him, I didn't have. But I think I had the BTT shunt, so no, I didn't have the Glen.
Texas.
I am not sure. I just know I have the BTT shunt and then the Fontan. So I don't know if they did all, the Glen along with the Fontan. They just called it the Fontan. So I'm not really sure. I kind of fell off care for a little bit and some of my records got lost. So my now doctor's trying to piece everything together.
So like a couple of days ago, when we first decided that when we were gonna, go do our first live here, I did go through some of my medical records. And of course, those are ancient, either on a typewriter or handwritten. And what doctor's handwriting is, that's kind of crazy. I know for a fact I did not have the Glen. I had the classic Fontan, and I still have the original classic Fontan. Another question came in and it said, what would be your top piece of advice for parents of young children with Fontan circulation? AJ.
Be honest with them. Oh God, peace for parents. Yeah, always be honest with your children. When I was growing up, my parents always never hid anything from me. Also when they're younger, they will know their limits. You find out how far you can run, how many sports you can play, or if you can't play any sports, and they know. I know it's kind of nerve-wracking, but we know. I guess I was young once. We know our limits. Yes, we push them a lot of the time to probably freak you out, guys, a lot, but we know our limits. We know when to take breaks.
Texas.
Pretty much what AJ just said, but my other thing would be, if they do want to do something that they can't do, maybe help them find a way they can still be involved. Like if they want to play football but they can't, they can be a manager for the football team or athletic trainer or something like that. Don't help them, maybe figure out a way so they can still be involved in an activity they really like. So, I couldn't play football. I was a manager for 7th and 8th grade. Of course, I still got injured and broke my wrist because I got hit when I was on the sidelines. But really, just be honest with them and, let them learn their limits and listen to them when they feel something's not right with them.
Laura.
I mean, definitely echoing that. My mom tells me now even that her piece of advice to herself, or what she promised to never do when I was little, was to never put me in bubble wrap. I mean, I had a very normal childhood, all things considered. A week before I went in to have my Fontan, I have memories at our newly paved cul-de-sac where they were building our house, and my mom was teaching me to ride a bike. So I mean, later that bike basket was used to hold a heart monitor, but I still rode my bike like any other 6-year-old growing up. And again, listen, your child will know. And so don't push, but don't hold back either.
Yeah, I definitely, agree. Same thing with all three of you had said. They know when they grow up and get older, Of course, not as babies and stuff, but they will know their limits. They're gonna push them. We all do. Mm, For me, I know sometimes, and my husband, he yells at me because I push myself and I make myself sick. And I just, I wanna do better for myself, and I try and push myself to do it, and it doesn't work out. But also let them know that they're not alone. There's other adults and teenagers, they can always reach out to any of us. Um, there's many different types of support groups, and there's support groups for parents. There's also support groups for siblings. I know that's pretty huge, is siblings make sure that they get talked to the same amount of time as your heart child.
There's also summer camps now specifically for kids with CHDs.
Yeah, and they also do like virtual camp too for summer camp.
Or, yeah, I was gonna say about the letting your kids know that there are other kids out there with similar. Oh, I grew up and I was always told, I'm one, one in a million, one in a billion type of case, blah blah blah. And honestly, I really didn't meet anybody with another heart condition until I was probably in my 20s, just because I was kind of kept in that bubble. And every time I went to the cardiologist, I didn't know those kids were there for that. I just thought I was going to the doctor. So definitely, let them know there are other kids out there like them.
Yeah, I kind of bounce off what Tex said. Like when I lived in Kansas where I had a regular cardiologist when I was a kid and a regular cardiologist when I turned 17, because I was such a big kid. They moved me up because my heart was so big. They said I grew out of the pediatric. But yeah. So, yeah, it's always. I just lost my train of thought. Oh my goodness. Um, but also piggyback, and if they can't do something like with me, I love sports, but I couldn't do them, unfortunately, after 7th grade. So I chose to sing, or I did something else. And when I chose to sing, I got good at it, and I got a scholarship to college and got to go on a cruise ship. So there are other things they can do.
Another question that came through here is, do you feel like you have PTSD after everything you went through?
Yeah, I totally denied it, but doing some more reflection in my 20s, I totally have PTSD, and it comes up in different ways. But like when I was a kid, Amanda, you were saying how you don't, still don't really like going to the doctor's office or anything. And when I was a kid and I would go to the hospital because a grandparent was in the hospital, or we were seeing, a friend's new baby, I always had this fear that some doctor was gonna come down the hallway and be like, oh, you're Laura, you're the one with half a heart. Well, this and this and this is wrong with you. And like looking back, I'm like, okay, maybe I should have talked about some things. Because I just tried to, I think, shove it aside and, kind of suck it up and be brave. But definitely some PTSD that I'm still working through and just figuring out how to be my best 36-year-old self.
Texas?
I'm sure I do, but I'm a man, so I probably just shoved it all deep inside. It's probably gonna like come out one day. I mean, I don't know. I mean, I guess because, from when I was 8 years old to about 3 years ago, I would just go to my regular appointments, minus about 12 years. When I fell out of care, I guess I've really never thought about it. But I'm sure there's probably something there. It's probably gonna be triggered at some point, and I'll have to deal with it then.
I know like Texas. I mean, I didn't really know if I had it. And then in 2016, I had 2 brain surgeries, non-heart related. Don't worry, non-heart related. And I remember being in the hospital and I go, oh my goodness, this takes me back to when I was 21. And I was like going, why do I feel this way? This is crazy. This is not good. And then I kind of like really thought about, like Laura said, you kind of think about like, oh, maybe I do have some of these things that I've been pushing down or not remembered because I'm not in, I mean, I've always said I'm in the hospital all the time, but really I'm never really in the hospital. So yeah, I bet I do. I do a little bit.
Yeah. I know I do. I kind of keep a lot of stuff inside and don't really talk about it. I still have flashbacks from my Fontan procedure. But it is what it is, and I just try and learn to deal with it. Some days it's harder than others, but I just tell myself, suck it up, buttercup, and move on with the day. So we do have another question, and it is, what careers do you each pursue? Laura, let's go with you first.
I am currently a teacher. This is my 14th year teaching, currently at a high school special education level.
AJ? Oh, yeah, AJ.
Well, I have tons of careers. I didn't know what I wanted to do for about all my life. I finally went back to school, got my bachelor's when I was like in my late 20s, early 30s actually. I work as a university counselor now, which I love, and I'm getting my master's in business for sports. So I've always wanted to go in like the sports field. So I'm like almost 35. I finally found the career I want to do. So finally.
Texas.
So I got my bachelor's in radio TV. I have a master's in mass communication. I spent 6 years in news media as a video journalist, producer, web person. Left that, went into education because it apparently paid more. And so I've been doing that for the last 8 years now. And I'm now a director of distance learning at a small college here in East Texas.
Nice. I work a full-time position. I have a lot of different jobs that I do in the office. I currently work from home. I've been working from home since the beginning of the pandemic, which is kind of nice, but I really miss like the facial, interaction. But I'm blessed that I can do everything at home. It's, it is what it is. I try and go to the office once in a great while to, get mail or whatever that I need to get. Another question came through and it says, do any of you have kids and are they heart healthy or do they have CHD also? We're gonna let AJ answer this one.
So I do have a 2-year-old. He's about to be 2.5. And when we first got pregnant, that was the most thing I was worried about. He was gonna have a heart problem like me, but they said it was like a 2% chance to pass it on since I was a guy. I guess being a woman is of greater risk. Like I think it's like 5 to 6%. Don't quote me on that, but that's what I remember from 2.5 years ago. But he became, we went to like, they made us go to like the most doctor, a fetal, what's her name? She's a very specialized fetal doctor, and they did a fetal echo. And I remember seeing both the chambers pump, and I went, yes. And then the ultrasound, I was like, what are you so excited about? I go, it's not like me. It's heart healthy. And she's like, oh. And my wife was laughing. But yeah, he's heart healthy, no problems. He has asthma, but then most kids get asthma when they're younger. So, but other than that, he's heart healthy.
And Texas?
I have 2 girls, ages 6 and 10. They were both born heart healthy. Like AJ, I was worried about them being, having a CHD being born. They brought in a specialist from about 3 hours from where we live. Apparently they bring them over pretty regularly to check babies anyways. But we had both of them checked out and they both turned out fine. So that was a big relief to me.
Cool. What about you, Laura?
Other than the scholars in my classroom, I do not have any children of my own. Now I'm 36, and honestly, I'm really happy with my life the way it is. And unless, again, they come through my classroom, I'm not planning on having kids. But when I was 25, I did see a geneticist, and they did say that if I ever wanted to have biological children, that the odds of them being heart healthy were the same odds as anyone else's chance.
For me, I do not have kids. My husband and I had tried for a couple of years, actually probably more than a couple of years. We ended up having to do some different shots, hormone shots, and things just didn't get worked out. You know, ended up being a leg infection and a stomach infection. And then it just came to the conclusion that it wasn't possible for me, and which I'm sad about it, and I know my husband's pretty sad about it too. But you know, we have other friends that have kids, and we can go and babysit them anytime we want. You know, we've talked about adoption once before, and right now I'm kind of glad that we didn't adopt, but then kind of, you know, wish that we would have. So it's like a 50-50. But that's it for me. Does anyone else have any last minute questions that they want to ask us?
I did not have a last minute question, but I am going to put this out there. Also, like a very wonderful woman who chose not to have children, Dolly Parton, if you are listening to this, I would love to go to Dollywood and ride all the roller coasters. So I'm just going to put that out there. Dolly Parton, I think you are one of America's treasures. Thanks.
Hey, if she gets to go, we all get to go. So
Dolly, if you could send me and my heart friends to Dollywood for the day, we would love it. Or if there was like an admission discount, because you know it takes two of us to really make one functioning heart. But anyway, Dolly Parton, thank you for being awesome.
We're gonna have a CHD day.
yes.
Yes, CHD Day in Dollywood.
Oh, that would be amazing.
We could do a live broadcast from there.
There you go.
We could. We could.
And then we'll volunteer and we'll mail off some packages of books for the Imagination Library.
Yeah. I'll even like pick up a broom and start brooming stuff or something, or even mop a floor. I don't care.
You can call it sweeping if we use a broom.
But I won't sing doing it. That's the only thing. I won't do it.
I'll
Yeah.
sing.
So if anyone had the question
sing
about
for you.
roller coasters, I ride them.
Me too.
Texas.
I went to Six Flags and somewhere in California, and I rode 11 roller coasters in one day. It was crazy. I mean, the friends I went with, they're like, "Are you sure you can go on roller coasters?" I go, "Yeah, nothing's happened to me yet." 11 later, I was still good. So, but ask your cardiologist for your kids, because I don't take me and Laura as a example.
I just got cleared to ride roller coasters, and I'm 38, so rode my first one back in December. So I'm gonna have to hit it up at Disney when we go.
So I used to ride roller coasters, and now that my health has declined and that I'm on oxygen, I'm kind of afraid to. And I don't think my cardiologist would really approve of it. But I know he's like told me, you know, a couple of times, you know, you only live once. If you don't like it, start out something small. But definitely ask your child's cardiologist or your own cardiologist if you can. You know, none of us on here are any medical professionals at all. Like we said at the beginning, we like to push our limits. We're all pretty strong-willed and stubborn. We do have, let's see.
I think Caitlin has a question.
Yeah, Caitlin, she was late joining in, and I guess let's tell her again what CHD we have.
I have hypoplastic right heart and pulmonary atresia. I'm 34.
Texas?
TGA, tricuspid atresia, dextrocardia, and then the ASD, VSD, pulmonary stenosis.
Laura?
Tricuspid atresia, ASD, VSD, pulmonary stenosis, and the Fontan circulation for a single ventricle.
And I have hypoplastic right heart syndrome, ASD, VSD, tricuspid atresia, single ventricle, and I think I'm not missing anything else. Another thing on here that, yes, we will make this public so you guys can share it. We are also going to record it and put it on our YouTube channel. And our next one is going to be February 14th at the same time, 8 p.m. Eastern time. And those topics for the next one is going to be scars. We're going to talk about our scars, emotional and physical, and our limitations. And then did any of you guys have anything else you wanted to add before we end this out, since it's 9 o'clock?
Thank you for joining us tonight. It was really fun. And again, Dolly Parton. Hope this gets to you.
Yeah, thank you for joining us. This is fun. Hope to see you guys next time.
Yes, and Heart Month starts tomorrow.
Yes.
So wear your red.
Friday, wear your red.
Oh, wear your red Friday. Sorry.
Or be like AJ and wear the red shirt every day of the week.
It's only 28 days.
Inside out. I'm just kidding.
I
You
could.
never know that.
No. It's a polo, so it's the only red shirt I have that doesn't have anything on it. So I need to get a heart shirt that's red, but I don't think I have any really heart shirts.
I know, I need a new heart shirt too.
I have one I got from Minnesota where I had my 2 open heart surgeries, and my grandma got it for me. And now I can't remember what it says, but it's like a chest and it has like stitches down the front. It's like I got fixed or I got stitched up in Minnesota or something like that. I still have it. I don't think it fits very much anymore, but I still have it. I wear it when I can. It's one of my favorite shirts.
Maybe we should just open a heart swag shop or something. I don't know. Just kidding. All right, guys. Well, thank you very much for joining, and we will see you guys on February 14th.
Heart Day! Woohoo!
Woo! Valentine's Day.
Yeah.
Bye.
Bye.